this is the first of what we are going to have as a series of Facebook Live broadcasts on a daily basis during the coronavirus crisis. We are here early in the morning. We're here, well, I should say where here is. I'm sitting in my bedroom, and my desk right now is an ironing board, and I have 3 laptops on it. As I was saying, we have maybe 25 reporters working full-time on the coronavirus issue. It is perhaps the biggest story that any of us has ever covered. As a result, we typically have a paywall on our website. We've dropped that for every coronavirus story that we're publishing so that anybody can have access to it. This is an issue that is deeply difficult for our society, and also this is life and death. And so we want to be able to be there as much as possible for you, and that's the reason for these podcasts or these Facebook live broadcasts. Today's topic is this series of orders that have come down in 12 to 15 counties in the state right now in the last 2 days that are described as stay-at-home or shelter-in-place orders. And I'm going to discuss what those mean, how those work, what are some of the rules, but first I want to do a little housekeeping. If you at any point go to sacbee.com, we are constantly updating our website with news stories, and right now we have emails. You can sign up for email alerts. You can sign up for updates, and let's see. We have just put on a request for investigative tips. So if you know something that we ought to know, that we ought to look into, go on sacbee.com, and we have a spot there for you to put in information that that can help us help you. Actually, let's see. Other stories that are on our website right now. Unemployment claims have spiked, and so we have a story telling you a little bit of what you need to know if you're in the position where you need to apply for unemployment insurance. We have a story on the assisted care facility in Elk Grove, where one of the 2 people who have died in Sacramento County was there. We have 3 more cases of the coronavirus at that place. We have Governor Newsom this afternoon at 4:00 will be giving an update on what the state is doing. He also said yesterday that it appears likely that schools will not be back on this semester. And let's see, we're coming up with a story. There are apparently only 9,000 public test kits available for coronavirus in the state, a state of 50 million. So we're looking at what's the process for that and where's that going. Anyway, so today's topic is this shelter-in-place concept. San Francisco and 6 other Bay Area counties on Monday announced the first shelter-in-place rule. Now, let's make a distinction. There's some counties have issued a order, a stay-in-place or a shelter-in-place order. And essentially, it means that most everybody has to stay in their houses most of the time. We'll get into details about when you can go out and what for. The Bay Area counties issued it as an order. Sacramento County yesterday issued it as a directive. The difference being that in many of these counties, including Yolo County, an order has the force of law, which means that law enforcement actually can go out and approach people who they think are violating the order. At this point, both the San Francisco and the Bay Area counties and Yolo County are saying that this is not an intent to arrest people or cite people. The officers that are going to be out are going to be working on education and letting people know what the rules are. So in Sacramento County, it's not an order; it's a directive, and that's the Sacramento Mayor Darrell Steinberg says a directive is just one step shy of an order. The expectation is that people will adhere to this order this directive, and that there won't be any need to take another step into the level of making it a law enforceable action. And so I know that I've been in my house for 2 days. I go out for a walk. That's it. Let's see what we have here is. I want to start answering some questions. But I thought I'd just go over with you the basics of the shelter-in-place rules. They are basically the same in every county that's imposed them. And let's start with who ordered them. It's the healthcare official in each county orders them, but they are typically working with the mayors and the board of supervisors in the counties to make sure that everybody's on board that they should go to this step. The basic the basic idea is this: is that the coronavirus is easily spreadable, and it's spreadable by close contact among people. So the ultimate goal, the thing that needs to be done now is to keep people away from each other. Staying at home is the easiest way to stay away from others. If you're out in public, there's the 6-foot rule, there's the washing your hands, there's no handshakes. Those are kind of the givens. As I said, this is a just short of a legal requirement. Let's see. I talked just now with Yolo County, where they have it as an order, and they're saying that the police are out actually, and they're going to be talking with people, but it's purely to tell them what the rules are and just play that educational role. So, in terms of what you can go out for. You can go to work, but the county and each of these counties is saying that you should not, employers should decide who's an essential worker and who's a non-essential worker, and that is essential that needs to be in the office. If you don't have to be working in the office, these directives all say, tell your workers, go home, work from home, telecommute, and then those who have to be in the office can be. Let's see, the businesses that are open. Well, there's a long list of businesses. I'm gonna read this list of businesses that can be open. Now, when I read this, it's the idea is that if you're sheltering at home, you can leave. You can go out and do what are considered essential activities, and those are just the basic fundamentals that you need. And I'll go through this list, and you get a sense of when it's appropriate to be out and about. All healthcare operations are legally open. They're going to stay open. That's they're fundamental. And the idea of keeping people at home and away from each other is so that the virus doesn't spread fast enough so that our healthcare system will be overwhelmed. That's the fear. It's happened in other countries. It happened in Italy. It's happening in Europe. It happened in China. There is a great fear that it will happen here. And the best way to avoid the healthcare, the hospitals being overwhelmed is these shelter-in-place rules. So healthcare workers, grocery stores, certified farmers markets, supermarkets, food banks, convenience stores. In Yolo County, all farm activity is allowed. Hardware stores, because they're essential to keeping home upkeep, are open. Businesses that provide food or shelter to the needy all are allowed to be up and running. News media, gas stations, auto supply stores, auto repair, mailing and shipping businesses, plumbers, electricians, exterminators, laundromats, dry cleaners. Restaurants now are in this kind of netherworld. Restaurants in Sacramento, in all these counties, are supposed to be closed for indoor dining, so you can't sit in and eat. You can, however, go in and pick up food. You can also order food from the restaurants. Business supply and support stores for business operations, Airlines are running. I was talking with the airport, and the airlines are seeing this huge drop in passengers. So that's the prelude to airlines cutting flights. So within a few days, airlines are going to be cutting flights drastically. Let's see, where's my home-based caregivers are allowed out. Professional services such as accountants, and I didn't see it on there, but I think San Francisco made a point the other day of saying, like, barbers, no. That's for a short-term shutdown order. Barbers are probably not necessary. Let's see. The question is, how long is this directive effective? This is where the uncertainty is. A few jurisdictions have said to the end of March. Some have said to April 7th. And now the idea is that we're absolutely on unknown territory, uncertain ground, and it's going to be play this week by week as we see what happens. Now, when we say see what happens, the fundamental thing we have to find out is, how much is it spreading? For the moment, that's been really difficult because we don't have the testing in place to determine how many people have this. 40 people, the last I saw from the county of Sacramento, is that 40 people in our county have tested positive for coronavirus. Two have died. But the 40 figure is probably it most certainly is artificially low because so few people have been tested. The expectation, there's a lot of rumor out there, and what I want to do in this Facebook Live, and what we want to do in the pages of sacbee.com, is make sure that we don't overstate or give you wrong information. So I'll play a little safe in what I'm talking about here. Is an order of magnitude more cases exist already in the county than we see in that 40. What's one thing that's important to know about the virus, according to all the epidemiology that we have at this point, is that about 80% of the people who get the coronavirus will either be asymptomatic, no symptoms, or have minor symptoms. And those would be symptoms that's similar to cold and flu. If you are in that position, what they're telling you is part of the stay-at-home or shelter-in-place plan is to go home. If you have coronavirus, you may not know it. It might be the flu, it might be a cold. If it's mild, then you should treat yourself as if you have the cold and the flu and stay at home. Stay there until at least 72 hours after all your symptoms are gone, or stay there at least 7 days after you first get the symptom. Oh, excuse me. I might be wrong there. You might have to be staying there 14 days after you first get the symptoms. I am not sure. You were to go call your doctor or your healthcare people only if this is serious and if you feel that you might be at some real health risk. That's when you go to them. If you have to call urgent care, do call urgent care before you go there so they can prepare for you. The idea, again, is that this can pass and you won't need necessarily treatment. Save the treatment, save the doctors, save the masks, save that for the people who are most ill. Who are the people that are most likely to become ill? They are going to be the older people. It sounds from what I've read that the older you get, the more likely you can have a serious case of coronavirus. Also, people with underlying health conditions, especially respiratory health conditions, can be are at more at risk. So I'm going to see. Can I see? Hold on. Let me be awkward here for a minute and see if I can find where the questions are coming in. Well, I'm going to check out my screen here. Somebody says my employer seems to be ignoring the order. They have only sent 50 people home out of 500. All of us could easily work from home. Any recourse if we feel like we should be sheltering in place for the sake of our health. This is the state. If you work for the state came out today with some more guidance to supervisors. And my initial thought is that maybe some supervisors have not gotten word. I think that I don't know this has to be discussed in the workplace. If your supervisor is not sending home people who can work from home, this is something that has to be discussed immediately. You can point to them that the State Department of Health Services has put out guidelines for the state today, and that the county health officers are in fact saying, don't be at work if you're not an essential employee there. So why is our city using different verbiage than other counties that are located a little over an hour away? The verbiage is essentially, I think what you're making is the distinction between shelter in place and stay at home. The health official at Sacramento County told me he didn't quite like that term shelter. Effectively, the same rules. We have the same rules imposed on us here, or the same directives as San Francisco and the Bay Area counties. They're basically all going off of the same playbook. In fact, when I asked Sacramento County, what are the rules that I need to know so I can write it in the story that we have on sacbee.com now about here's what you need to know and need to do, he said, go to San Mateo Health Office has it laid out, and those are the ones that we're all following. So the verbiage difference is that Dr. Peter Bielenson here at Sacramento County said he doesn't particularly like the idea of shelter in place, and to my thought it was like as if a bomb's, he wants people to feel like you're living some modicum of a life. It's far, far from normal. It's an entirely constrained life, but rather than shelter in place, live in your house, go out of your house anytime you want to go for a walk. If you're training for a marathon, go out and do the full training. If you're riding a bike, ride the bike. Go for hikes in the hills. So you can get out there anytime you want. Try to stay 6 feet away from anybody that you run into out there. Let's see what else we got here. Is Travis Air Force Base training for possible martial law? Now, the question of martial law, we could get to the point soon where we at the Bee should know a little bit more about that. The governor has said that he can call in the National Guard if needed. He did not distinguish what he was talking about. It was basically the National Guard can keep the peace. National Guard can station itself in the community to be a liaison with the government and an educational group too. So the idea of imposing law enforcement-based orders is we're steps short of that right now. Travis Air Force Base, by the way, is one of the coronavirus, detention centers or quarantine centers right now. You remember the cruise ships that the Grand Princess was held off the coast of California for 5 days while 21 people on that ship had the coronavirus. The people who are healthy from that ship have been taken to, those who are California residents have been taken to Travis Air Force Base. Listen, it says here, what about Yuba Sutter area being super quiet about it? I don't have with me the statistics on cases there, but if you want to, a very interesting place to go is the Johns Hopkins University coronavirus map. If you Google Johns Hopkins University coronavirus map, it shows data internationally for coronaviruses, including in states in California. I don't actually know that it gets to the county level, but Joshua, you asked that question. I think that we should be expanding our scope. We've been talking to Placer, El Dorado, Solano, Sutter, Yolo, but we'll try to get reporters talking to Yuba and Sutter and seeing what's going on there. So Ryan Lewis, my boss, is watching. Let's see. I said mail and shipping business. Yeah, it's, what Yolo County is saying, by the way, is that shop, but a lot of stores will be closed if they're non-essential. You can shop online, and Yolo County wants you to support your local businesses by shopping online and having stuff shipped to you. I'm hanging in there. Yes, I am hanging. Hope you're hanging in there. This is. I have never. I'm not young, and I have never covered a story that seems to have this much drama. That has me as concerned as this. Somebody was saying the other day, or this morning, another editor was saying that this seems to make 9/11 pale. I don't know if you could exactly say that, but the idea that we're stuck in this, and we're stuck in this together, but we don't know how long we're going to. We don't know how long we're going to be in this. If the Sacramento County has a stay-at-home directive, why is the state not sending more people home? This is something that I think might get brought up at 4 o'clock with the governor, because we're hearing a lot of state offices where people are feeling that they are supposed to still be at work. The governor should clarify this. He may say that the rules for essential and non-essential employees at the state are different from non-state employees here in the county. This is something that we hope to hear more on when the governor speaks at 4 o'clock. Construction businesses. I want to check that. There's the house across the street from me. I'm looking out the window now, is under reconstruction. They were here working yesterday, but they're not here today. That is a good question. We'll put that on our list, because if anything, California does need, among other things, is more houses. And so if this were to infringe on the construction trades, that would be a double negative for us. Sorry if my finger keeps poking in front of the screen. Let's see. Let's see. We have about 360 people watching. Let's see. Every county has their own Department of Health and sets their own rules or directives. Interesting. That brings up a good point. As I said earlier, Sacramento County and the Bay Area counties, YOLO, are all playing from the same playbook, and that is this list of restrictions that is basically the same, but yet there are differences in the counties. Like I said, that here in Sacramento County, it's just a directive. You go to Yolo County, it's an order. The Bay Area, it's an order. What they're saying is slightly different than what Gavin Newsom has been saying, and this is confusing to people. And I even had a certain public official yesterday grousing that here in Sacramento that the state and its counties are not quite on the same page. People are jumping the gun on each other. When San Francisco announced its shelter-in-place rules on Monday, they even bragged that they were ahead of the rest of the state, which strikes me as not necessarily something to brag about. The state should move along, in unison here, and so there could be less confusing. What about jobs like Dish Network, Comcast, that go home to home? Frankly, I think they're playing this by ear in terms of what they're going to allow and not allow. And I suspect that if we're all going to be spending the next 2 weeks, 3 weeks, 4 weeks at home, that the health officers are going to say, that's kind of if it's not an essential service, how about it's essential to community happiness? So we need things to do in our house. And so to have access to the internet, to have access to entertainment in your house seems to me to be important. We'll look into that and make sure that we give you the right information. We're going to try to answer some of the questions I'm not answering here. We'll try to answer either in the paper or maybe with tomorrow's Facebook Live broadcast. That reminds me of another uncertainty here, and this is this one I've been thinking about myself. What do I do? Can I invite my buddy Bill over and have a drink with him, because I think we both need it? And there seems to be there hasn't been a lot of direction on that. But I did talk to Dr. Peter Bielenson here in Sacramento County. He's the chief health director here. And he said that his view on this might be less strict than others. So, this is where you're going to have to you know, you want to err on the side of caution. He says if you feel healthy, you can invite a friend or two or three over if they are healthy. That's probably not the case with somebody 65 or older, or somebody even 60 or older. You probably do not want to have very many people at all going in and out of that person's house, because so many of us can have the coronavirus and not even know it. Then if you associate with somebody who's older and more susceptible, you could be causing a real problem there. Now, I've had people say that no, nobody should be visiting anybody. It's a tough question. Dr. Bielenson here in Sacramento County says you got to have some kind of a life. If you're healthy, if you're washing your hands, if you're staying away from your friend, you're sitting on the other side of the room, yeah, he says, yeah, you can visit. If you go out for a walk with a friend, really you should stay 6 feet apart. I had that experience on the sidewalk. I was out for my walk on the sidewalk yesterday, and it was impossible if somebody's coming the other direction on the sidewalk to go 6 feet away. I was skirting into flower beds, and I thought this is a little silly. Can we both just hold our breath when we pass each other? Anyway, that's just me talking. I don't know. I think that if you pass somebody quickly, you're gonna be fine. So I think I've gone for a while here, and I will close down. Let's see. Let me just check here. See if I have any more good questions. Let me just I guess a synopsis here. We're just starting this Facebook live daily broadcast today. This is the first one. We were focusing on what the rules are for being in a county that has a shelter-in-place or stay-at-home directive. If you go to sacbee.com, there's a story about that with more details. We have 10 stories on our homepage right now with a variety of topics related to coronavirus. We are in this for the long haul. There's nothing else we're going to be doing at the Sacramento Bee other than, well, I have another story I have to cover today that doesn't involve coronavirus, but it's transportation. But for the most part, we know what's important, and it's being a part of the community with you, helping you, and getting as much good information out as possible. As the mayor says, stay calm and carry on. And thank you for being with us today. Again, check sacbee.com. You can sign up for alerts and newsletters related to the virus, and we'll see you here tomorrow. Tomorrow's Facebook Live, we'll publicize it beforehand to let you know when we're going to have it. So I appreciate you all being here, and we will keep seeing you. See ya.